steal. We laugh, we learn, we go too deep. Sometimes the tea's too hot to keep, but we're here, no shame, just chill. Grab a snack, let's talk what's real. Welcome to the Feel and Spill, where the combo's hot and the vibe is real. We fill your plate and spill the tea with honesty, heart, and a little therapy. Yeah, come hang for a while. It's all love, all laughs, all style. This Feel and Spill.
Hi guys, welcome to the Fill and Spill podcast. I'm your host, OG, and
I'm that Beth.
And we're here to interview Dr. Patel. She's here to help us understand fertility, and she's a pharmacist. Dr. Patel, would you like to introduce yourself and tell us a little bit about yourself?
Sure. Thank you guys so much for having me today. I'm really excited about our conversation. A little bit about me. My background is in pharmacy, but I'm a holistic provider. I believe in combining Western and Eastern medicine and lifestyle changes to manage women's hormone health. And I'm sure we'll get into this, but my journey with everything that I do now started with my own diagnosis and management of PCOS, polycystic ovary syndrome. And yeah, my background professionally is as a pharmacist, but right now I practice with both.
Oh, that's so cool. Interesting. I have a lot of questions for you today.
All right. I'm excited. Yeah.
So let's get into it, guys. So today we're going to ask Dr. Patel, what are the most common causes of infertility that you see in women?
Yeah, so the number one cause of infertility is PCOS, polycystic ovary syndrome, and that happens due to a hormone imbalance, and that causes women to have cycles where they don't ovulate, or they tend to have really, really long cycles where it could be anywhere from 30, 60, 90 days. And with the cycles being so long, it gets harder and harder to predict that small ovulation window.
Okay, cool. Does that also affect like miscarriages in a sense?
It can. So miscarriages commonly happen because your body's not able to produce enough progesterone to maintain the pregnancy. And so a hormone imbalance can mean that your body's not naturally producing enough progesterone. And when, say, a couple is able to conceive, then if the progesterone levels are low and the body's not able to keep that progesterone where it needs to be, it can lead to miscarriage.
Got it. Understood. Wow, that's interesting. All right. And what role do supplements play in fertility treatments?
That's a good question. So supplements, what I say is like it says in the name supplement, it's in addition to lifestyle changes. So lifestyle changes are the core to managing hormone imbalance, but supplements can help support that. And I kind of view supplements and medications as kind of like, they can be like crutches. Like, for example, say somebody broke their leg and they need the leg to heal. But if they're constantly walking on the leg, then the leg is not going to heal. So you need crutches to allow the leg to heal. So similarly, you may need supplements or medications to help your body kind of do its thing, support it in helping it heal itself. But some medications and supplements, like once you come off of them, if you didn't make those changes, then you're gonna still struggle and have those symptoms come back.
Wow, interesting.
Yes.
What do you feel are the other common conditions that also cause infertility? Because I mean, there are several others that can do that too as well.
Yeah, so endometriosis is a common one. So that's inflammation is one of the key things that worsens endometriosis. So endometriosis is when there's tissue that forms in places that's not supposed to, like for example in the pelvic region, things like that. And so that can lead to a lot of really heavy menstrual cycles, for example, is one of the symptoms of having endometriosis. But that's another common reason for infertility.
My mom actually was diagnosed with it as well.
Sorry, forgot earlier to introduce Mama D. My apologies.
She has officially returned.
She wasn't in our last couple episodes, but we're glad to have you here.
Thank you.
And what questions do you have for Dr. Patel?
Well, I'm an older generation, of course, and I am in like premenopause right now. So, hormones are a big thing for somebody going through menopause, So, I mean, do you have any suggestions? Right now, of course, I'm on an estrogen patch. So, and that helps. It does help. It doesn't, of course, take away the symptoms, some of them. It does help reduce it.
Right.
But, do you have any other suggestions? A supplement or anything that women of the, older women can do to help themselves?
Yeah, so naturally, as we get older, our bodies go through perimenopause, which happens 10 to 15 years before menopause.
Mm-hmm.
And so during that time frame, we may start having some of the symptoms, like occasionally having hot flashes and insomnia, things like that, irritability. And that's because our hormones are fluctuating, and over time our periods get like longer and longer and longer, lighter and lighter and lighter, until there's no more menstrual cycle for 12 consecutive months. And so that officially is like the definition of menopause. And so some things so that, that's a natural thing that happens to all of us women, and it's inevitable, it's going to happen. And so there's things you can do to manage the symptoms, like estrogen patch, for example, because over time, as we approach menopause, our progesterone and estrogen, they decline and
Sure.
they stay low. And so estrogen can help, but there's other things like, and this is mostly symptom management.
Yeah.
So,
Yeah.
for example, like inflammation gets worse, like you're more prone to inflammation. So taking maybe like an omega supplement can help, like an algae based or fish oil based, to help manage stress and mood disturbances. Things like ashwagandha can help as well. Um, and then making sure that you're taking enough like calcium and vitamin D, because women, as they approach perimenopause and menopause, are more likely to develop osteoporosis or break a bone. So that's important as well.
Quite interesting. I know there's a lot of supplements out there that on the internet that are like, well, try this, you can get pregnant faster. Like, in your opinion, does those supplements actually work, or like, what are the misconceptions about it?
Yeah, so I think anything that guarantees anything, just be aware. Like supplements, they're not regulated. The amount of the active ingredient in supplements, like claims can be made, but it's not regulated by the FDA, which like medications are. And so that means that there has to be proof that this dose works and it's effective and it doesn't cause harm. So supplements, there's not much regulation around it. And yes, there are some benefits to it, but I think we have to be aware that if anything is claiming that you can get pregnant within 30 days to 90 days, that's like a huge claim to make. So like no one can guarantee that. But there are some benefits to supplements. But I think overall, keeping in mind that you have to understand what you're taking, like looking at the active ingredient, what it is, what it does, be aware of side effects, and any supplement or medication, always consult a healthcare provider, because it's important to know that you're taking the right dose, you're reducing the risk of side effects and interactions.
I mean, you really have to know what your issues are before you can
take anything from the internet,
right,
or anything.
Right.
I think a lot of women out there don't understand their menstrual cycle.
Oh yeah,
I'm one of them. Like, it's
weird. That's very true.
Like,
a lot of women don't.
Yeah, they don't. So like when miscarriages happen and like infertility and all that happens, like they're not understanding. Like, okay, if I'm prescribed, like, let's say for example progesterone, if I'm prescribed progesterone, it's like when to take it. Like, I think there's a lot of women out there that don't know when their luteal phase is, things like that. So can you shed some light on that? Like, how do you know?
Yeah. And I think it's so unfortunate, and I think it's great that we're having conversations like this to shed light on this, for people to learn the right information, because it's so unfortunate that I'd say, like, I hear stories now that, like, my doctor had told me the same thing, like when I got well, first it took me 3 different doctors to get diagnosed with PCOS over 10 years. And then once I finally got diagnosed, I was told, well, just take birth control.
Mm.
And to this day, I still hear the same thing. So not much has changed. Like there's hardly any education that we women get around our menstrual cycle. There's hardly any education we get around like, it's important to understand our cycle, which helps us in like conceiving and things like that, or to prevent, conception if somebody is not ready to get pregnant.
Right.
And even outside of pregnancy, it's so important to know what our menstrual cycle is like, because it's actually a report card of our health for us women. Like what we do now actually affects us in menopause.
Mm-hmm.
So it's so important for us to like build muscle right now, to manage things like, to build that muscle now, so that as we get older, it's harder to build muscle. Our body loses that muscle mass over time. So it's so great that we're having this conversation. But to go back to answering your question of a little bit about like the menstrual cycle, it still surprises me. Like many people don't know that we have 4 different phases of our menstrual cycle. A lot of times we all may commonly know the first phase, the menstrual phase, because that's our period. So we can easily see that like visually. And so that can be anywhere from 1 to 7 days. The second phase is the follicular phase. So that's when basically our body is starting the whole cycle again.
Mm-hmm.
The endometrium lining starts to thicken. Our body stimulates the ovary to develop and release an egg. And then the third phase is ovulation. So this is the phase that we want to be aware when we're in, if we want to get pregnant or don't want to get pregnant, because that's our most fertile period. But for us women, we're only fertile for about 24-ish hours, whereas men, they're fertile 24/7.
Wow.
Wow,
Yeah,
very
that's
narrow
interesting.
It is.
Take
It
notes,
is.
ladies.
Yes, it is an extremely narrow window. But sperm can live in the body for up to 5 days. So that window can be extended to about 6 to 7 days. And then the next phase we go into is the luteal phase. So this is when your body is either starts to shed to prepare for the period, or if there is implantation, then you enter into your body making more progesterone to help you maintain that pregnancy.
Where you probably see some of those, also those like PMDD symptoms start to
Yes.
come into play,
Yep.
right? Because I think that's when like a lot of, at least my clients that have like some of the irritability, the rage factor that really start to come into play, or even the significant depression. And then they'll kind of have it and they'll start to their period, and they may even have a few symptoms a little bit after, but then after that, they kind of start to go back through this process all over again, right?
Yeah, so that is contributed by the fluctuations in our hormones. So when we are on our period, it's basically kind of like our estrogen and progesterone is extremely low.
Mm-hmm.
And then afterwards, our estrogen starts to rise, but progesterone doesn't come into play until after ovulation. And so if someone has a hormone imbalance, like if they're not able to produce that progesterone naturally, then they have too much estrogen, and that contributes to a lot of like the mood disorders, like really heavy cramping,
Right.
Things like that.
And so, and I think that's when it's important, right? Because it's like you have to know your body.
Yeah.
So getting your hormonal levels checked and all those things, and making sure that they're regulated right, so you can figure out, okay, what do I need to do? Do I need to increase my progesterone, right? Like, do I need to do these things? And I think it's interesting that, so like one of the other things I do is, right, I'm an ADHD specialist. So when I see that time of the month come up, all of the ADHD symptoms start to exasperate around the time of the cycle. And also like when my mom is going through perimenopause at that age, I also see them become exasperated. And women are like, I don't know what's wrong with me. I'm having this brain fog and all of these things. And I was like, well, there looks like to be some other things at play. And that's when I start to kind of discover like they were never diagnosed with ADHD.
Yeah.
So when that happens, they start to unmask a lot of those symptoms. And so then it kind of comes out. And when I balance the hormones, and then they get on their like ADHD supplement also, or ADHD medication, it starts to be like, okay, now I can actually feel better.
Yeah.
I don't have this fog. I'm not feeling like I have to drag myself to get out of bed.
Oh yeah. Yes, definitely. Yeah, I think, a lot of it comes from, once again, like not having that proper education, right? Because if somebody doesn't recognize that, hey, this is related back to either ADHD or hormone imbalance,
Mhm.
then we start doing things that may not help us, right? Like, say, we start doing things that we don't know, like, for example, just drinking so much caffeine to try to
Sure.
have the energy to get through the day. But caffeine can cause sleep disturbances, which leads to other, cascade of events that is not working for someone, right? Another thing is, for example, like, a lot of times women are just told, like, oh, well, just lose weight. But if you're not addressing the hormone imbalance, then it becomes really challenging
Right.
to do
Mm-hmm.
that.
Right. And, like, I know you'll hear some people say, well, I've lost like 20 pounds and now I'm actually seeing my cycle start to appear and different things like that. And some women do get pregnant when they do lose weight and it does help. But if you don't have all the other pieces at play,
Yes,
it's still a losing battle.
exactly.
I
And,
think,
and it's bad when the some things, the first thing somebody does is tries to self-diagnose,
Yeah.
Yeah.
right? The internet is there with all of this information, but really you should go see a professional. You know, it's really important that you see a professional and get diagnosed and find out what is going on so you know how to treat it, you know.
Yeah.
And like you, it took you 3 doctors before you got diagnosed with anything, but thank goodness you did,
Also,
well,
when it
you
comes
know,
to
and get the
testing
help.
too, like when you, let's say for like for example for miscarriages, when they run tests and stuff and they come back all normal, like okay, so what is the explanation as to why you got a miscarriage? You know what I mean? Like
Yeah.
there's a lot of tests out there that the doctors can give you, but okay, they come back normal, then what? Like
Yeah.
what's the answer? Do you have any like insight on that?
So I would say if you're not getting answers, so I think, going back to getting a right diagnosis, and it comes to advocating for yourself, because
Mhm.
unfortunately a lot of time we as women are made to believe that our
yeah,
symptoms are in our head, or they're
Mhm.
not that big of a deal,
Mhm.
or
this is part of the process,
yeah,
or let's just get put on birth
yeah,
control
exactly,
as the answer.
yeah,
Right? Because I know you mentioned, like, when you were trying to get pregnant at one point, they suspected you had endometriosis, but
Yeah.
they never really did any collection of symptoms, never like testing or anything. And that was years ago.
yeah.
Years.
Yeah. And then I started having ovarian cyst, right? And I mean, I was going to the emergency room with
Oh
it,
gosh.
but they finally said, you know, we're gonna put you back on birth control. You're right. We're gonna put to stop it from growing or whatever. And then finally, I had to have one of my ovaries removed,
Oh, wow.
and that's when they discovered how bad the endometriosis is. They couldn't even get to the other ovary.
Oh wow.
I had so
That's
much.
horrible.
So, you know, they just took the one out and left one of my ovaries in. So I've had a miscarriage before, and I've had ovarian cyst, and I've had a lot of trauma,
I've
you know.
had three.
But
I've had three.
yeah, no, I didn't have three, but
Yeah.
yeah. So it's, like I said, it's
My-
some things the doctors can't
Yeah.
explain. They just can't.
Mine was three
Right?
back to back.
So I think it's good to maybe get a second opinion if you're not getting answers.
Mhm.
Compare In some ways it's so unfortunate because a lot of things haven't changed. Like, we are still, like I told you, right? Like, I still hear the same stories that I got told like 15 years ago,
Mhm.
like, even with endometriosis, a lot of things still go like, we don't know. But in some ways there's so much advancements in testing and imaging, and if you're not getting the answers you need, I say, advocate for yourself and see if you can find another provider to get the answers. Ask for like detailed explanation for what, like, your lab work means, what imaging means. Like, hey, things keep saying that it's normal, but clearly, like, something is
Something's
going
going on,
on with my
right?
body. So is there other testing that can be done? Is there something else that we could do that can help us get the answer that we need? Because it's kind of hard to know what to do if you don't have like an answer or a diagnosis.
Right.
Well, in most of your lab work, right? Like a lot of the things have this range, but the range is huge, right? Because I like have Hashimoto's, and when they tell me about, oh, your thyroid's in normal range, and it's at like 3 point something, I'm like, I'm still feeling these symptoms.
Yeah.
Like I still feel the fatigue. My body does ache. All of the things that happen. So you say it's normal, but it's not.
Right. So that's a great point. And what's normal or in the normal range may not be normal for you.
Mhm.
Yes.
And that range is so broad and it includes like so many that those numbers come from like a diverse group of people, including men and things
Sure.
like that. So whatever, even if you may fall under that normal range, if you still have symptoms, then what's more important is what you're feeling.
Absolutely.
Yeah. And it's not just a number. And I mean, that's one of the things we learn in school is that, you know, you treat the patient, not the number. And it could be vice versa. Things can look like, you know, someone is out of range, but if they're not having symptoms, then that's okay for them.
Sure. It's just it's very hard. And I mean, there's lots of other things that obviously contribute to the medical model, and you know why some doctors kind of look at you as a number. I mean, there's lots of reasons
Yeah.
why,
there
and it's very
is.
unfortunate that it happens that way.
Yes, I agree. I think that, you know, over time there has been a shift. I think a lot of people, especially like, I think now more and more people are getting to want more answers with their health. A lot of people are more into that preventative medicine instead of just treatment. A lot of women are starting to learn about their cycles and they're realizing, like, hey, something is up. Like, I think there was a lot of this language of, well, as women, we just have to struggle with our cycles. They just have to be painful. We just kind of have to deal with it. But that's not true. Like, our periods are not supposed to be painful every single month. And if it is, then that's means your body is telling you that something is going on. If your period is so painful that it's interrupting your daily life, like you have to miss work, you have to miss school, then that's a sign that something is off and it needs to be addressed. And the longer that it gets put off, then the harder it gets to manage it. And that's the unfortunate thing when a lot of women just got put on birth control for 10, 15 years and then, you know, they want to come off and then they want to get pregnant, but they never addressed what the problem was. And then when people come off of birth control, it's like, oh, well, you still have this thing that we didn't know what it was because we just put you on birth control. And so I think that's one of the reasons why, you know, the infertility rates are going up because we never really addressed those problems. We just covered it up for 5, 10, 15, 20 years. Like if someone gets on birth control age 15, nowadays, you know, people try to maybe conceive in their 30s. That's like 15 years or 20 years somebody's been on birth control, right? 15 to 35, yeah.
And what does that do to the body? Right?
What does it do to the body? Yeah.
To be on birth control that long.
Yes.
You know, actually, I was reading something the other day and it was talking about like going through like perimenopause and it was talking about the use of estrogen patches, right?
Yeah.
And saying that basically estrogen patches will help, of course, manage some of the symptoms, right?
Yep.
But in fact, what it does is it prolongs menopause because you're basically just managing the symptoms instead of just naturally going through the process. And usually that can speed it up versus that way. And it's just very interesting how, like, what it does to our body.
It is interesting. It is. So if we do take birth control for that long or any extended period of time or any even like using a patch, so basically we're giving our body synthetic hormones like man-made hormones, and over time your body is like, well, I don't need to produce my own hormones if I'm already getting something that is similar to what the body is supposed to get. So when people are on birth control for that long and then they come off, it takes a while for your body to be like, oh, hey, I need to start like making
to reset.
To reset. Exactly.
And birth control isn't always given just to prevent pregnancy. It's also given to other like health conditions as well. Like I know that there's some birth controls out there that help with acne and things like that. So what are the misconceptions around that?
Yeah, so this goes back to birth control can help treat some symptoms, but it's not going to address
Yeah.
like why the acne is there. So if, for example, somebody is having acne related to PCOS, then that means they have high like inflammation and testosterone levels. And so you can take birth control and it can help lower those levels temporarily, but it doesn't address inflammation. It just kind of addresses that higher testosterone level by lowering it. But it doesn't address the inflammation. It doesn't address things like insulin resistance. So birth control is commonly given, but it doesn't always, like, once again, it masks what the reason is. It's just managing the symptoms. And if somebody wants to do that, that's fine. But what's unfortunate is that a lot of women weren't explained these things. Like, I wasn't told this when I was put on birth control. It was just like, here's a prescription. I'll see you in a year for refills and some labs. And I was like, okay.
Like that was it.
Yeah, and I was like finishing pharmacy school at the time. We hardly learned about birth control. We hardly learned about PCOS. So I just did that for like 7 years. And then when I started having symptoms again, I went back to the doctors and I was like, hey, like this medication's not helping me. But they're like, oh, well, just continue it until you want to have kids and you can take metformin if you want. And I'm like, okay, but like,
how does
that's not really solving the root cause.
That's kind of interesting that they prescribe metformin.
Yeah, so metformin can help with insulin resistance, but it's prescribed for diabetes. Like it's not studied in people with PCOS.
Oh, that's so interesting.
Yeah.
I think also too, you know, like one of the interesting things is that I have a lot of people who ask sometimes when we're talking about infertility or maybe talking around things, right? The $1 million question. Someone proposed to you the $1 million question. How long should someone try to get pregnant before they reach out to like a provider when there's actually like thinking that maybe there is some kind of concern?
That's a great question. So I would say, so the way I practice, so I actually help women with PCOS that want to get pregnant. And I always say that give yourself 3 to 6 months to know how your cycle is, know when you're ovulating before you're actually ready. The whole language is like, okay, well, just come off of birth control right before you want to get pregnant, and then you'll just get pregnant. And that doesn't always work, especially if you've been on it for like 5, 10, 15, 20 years.
And there's other health conditions going on that you didn't know you had.
Exactly. So I always say, give yourself, I mean, if you have that, if you know that you want to get pregnant in 6 months to a year, that's actually even better because it takes time. Like our hormones fluctuate. The changes that you may make today in your lifestyle, you will see the effects in 3 months, 4 months because of our hormones fluctuating the way it affects our body. So for that question, I mean, it really comes down to the individual. What's concerning is when providers just say try for a year and then come back, but what tools are you giving this couple to support themselves, right? Like, does she know her cycle? Does she know her ovulation window? Does she know how to test her ovulation window?
Some of them tell you to download the apps.
Yes, so the apps can help.
I was gonna bring that up because I was curious. Like, a lot of women have these apps on their phone. I'm sure all of us do, that tracks their cycle, and basically it tells you when your period starts, when it ends, when it's the luteal phase. Like, it just, so it helps them track like everything. Back then we didn't have that. But we had to figure it out.
That is helpful, but it's only based on like whatever information you give it. It doesn't take into consideration things like if you get sick, if you travel, if you go internationally and you're changing time zones, and then like it doesn't account for things like jet lag
or stress.
Or stress. Like if you're going through stressful periods, it doesn't account for that. So I would say use that as like a tool and a guideline, but I would not base just your ovulation window on that app. It's really important to know what the signs are. Like your body gives you some signs, like increased libido is one naturally. Second thing is cervical mucus that changes. So having thick egg white like cervical mucus helps the sperm reach the egg, and so that's a sign that you're ovulating. Change in your cervical position inside your body, it becomes open and soft, and so and to test that, like if people don't know, then that one is a little bit more challenging, but you have to kind of pay attention to these things like throughout your whole cycle. So then when things are different, but like when you're taking a shower, you can use your two fingers and then you can test your cervical position that way. So those are some ways, and then you can like track it on the app, and the more you track it, it becomes more and more accurate. But the app alone, I would say, is not the only way to test. I mean, nowadays there's also different strips you can get to test. Like you can get even progesterone strips after ovulation to confirm that you did ovulate and your progesterone levels.
You yourself is the best tool.
Yeah.
Know
yeah.
your
Yeah,
body.
know your body.
Know your
And
body.
if you don't know your body, definitely do some research and seek professional guidance on how to better understand your body. I think that yeah.
And I know, like, I feel like we live in kind of like a man's world where we are kind of shut off in allowing ourselves to know our body. We're thrown into like, if there's anything wrong, it's just like take birth control, and then
Yes.
and like we as women, we have our intuition and our gut that is like so powerful, but we are always told kind of like to ignore it, ignore our voice, right? And there's so much like external things that get into our head, and like a lot of times we're so out of tune with our body, but our body really, like you're saying, tells us what's going on. Like if you are constantly having headaches, your body's telling you something's going on. If you're constantly fatigued, brain fog, like with your cycle, if it's constantly painful, or if it's getting longer and longer and longer, or your bleeding is getting heavier and heavier and heavier, then that's your body's telling you that something's going on.
Absolutely.
I know food plays a lot into infertility, especially in the United States. There's like all these foods that have all these hormones, and especially like chicken and things like that. What are your thoughts on that?
So I would say the first thing is being mindful of foods that have a lot of added sugars in it. So things that are disguised as healthy, like Greek yogurt is healthy, but if you're getting the kinds that have flavor, if you look in the back, it could be like 13 grams of added sugar and 13 grams of protein. Well, that's not really great. So like for that one, I would say get a plain Greek yogurt and then add your own like fresh fruit at home. So just be mindful of that. Trying to limit like packaged and processed foods. And if you read the first three ingredients, and if any of those first three ingredients are sugar or things disguised as sugar, like dextrose,
the long names,
yeah,
the long names you can't pronounce,
or also products that just also cause inflammation.
Right. All those things contribute to inflammation.
Because gluten and dairy, we know that obviously goes into inflammation, and sugar. Even though they don't really say that, like when you visit your endocrinologist and they'll say, oh, gluten and dairy kind of do this, but sugar is actually one of the biggest byproducts that actually causes a lot of those symptoms. At least that's what I've experienced.
Yeah, and so a lot of foods are disguised as sugar, but they're named other things. Artificial sweeteners, things that are like low fat, can have other things like other like like other processed foods instead to make it like a more creamier product, things like that. So just being mindful of those things. But ultimately, like if we're gonna, try to get just for someone maybe starting at the basics, it's just limiting like processed foods, trying to eat more like whole fruits and vegetables and things like
more
that.
Clean eating.
Yeah, clean eating. And then like the thing with gluten and dairy, just being aware if somebody is experiencing things like the inflammation. So if someone does have an intolerance to gluten and dairy, it can show up as inflammation, like rashes, having sensitive skin, having acne, upset stomach after you eat those foods, going to the bathroom more often after you eat those foods. So just being aware of those signs for yourself.
And knowing what your body can tolerate.
Yeah, exactly. Did I answer your question about a couple, if they're I want to make sure I did answer that fully. Okay.
Yeah,
Okay.
about 3 to 6 months.
Yeah.
Usually afterwards, which I mean that's pretty about right. Like with hormones and everything, with adjusting and that kind of thing.
And then the key thing is that it's like, what are you actually doing in that time frame? Like,
True.
that's what actually, what I was saying is like knowing your cycle. Because if you're just like trying for 3 to 6 months, but you don't know what you're doing to try, then like that's not actually helpful. So I would say have like an intentional plan that hey, like in this 3 to 6 month time frame, I want to make sure I know my cycle. I want to make sure I'm ovulating, and then I mean, infertility is like 50% also male factor infertility. So when testing is being done, also making sure that the male partner is also being tested to see that, is there anything on his end that can be improved.
Well, and I think the other thing is too, is that obviously we have a lot of things we have to look out for, right? Are we managing things? But I think one of the biggest pieces is we can also get very caught up in it.
Yeah.
And get very stressed out over it, right? And it's like, well, why is my body not working right? And the stress can also not help the situation.
For sure.
And it's hard, right? It's hard not to be down on yourself because it's just like, why can't I?
Yeah.
Right? Considering our society puts a lot of emphasis on family and as our role as being moms and mothers.
Yeah, definitely. Yeah, and I think this kind of goes back to the whole like give yourself time, because a lot of times it's that misconception that I'll get pregnant in 1 month, 3 months. So then, I'm not worried. And then usually when a couple is like, okay, we're ready to have a kid, it's usually like the next day that they want to have the kid, right? But that's why we need that time, like that time to understand, so that you don't put that pressure on yourself, and then it's like, oh my God, it's been like 1 month, 2 months, 3 months. Okay, shit, the months are getting longer and longer. Like, what? It's not happening. And then you add more of that stress on yourself. Then maybe there's external stress from a partner, family, things like that. But this is where like giving yourself that time, knowing your body, starting to understand your body and understand what's going on, and just even like outside of fertility start. I feel like sometimes as women, we're so like on the go all the time that we don't take that time to just be like, hey, like I'm having this pain, like constantly, where's the pain coming from? Or just like being more like fatigued or things like that.
And sometimes, I think the pain is a sign of there's something else going on. Even when I have couples or women that have like painful intercourse.
Yeah.
Right? Because there are some women that do have scar tissue towards their cervix and have other places too.
Yeah,
so,
inflammation,
right? So there could be many signs that stuff's going on. And if it is painful, right, also, we shouldn't have to endure it.
Yes. Agreed.
Right? And also, too, maybe let's take a look and see what's going on.
Yep. Definitely. Yeah.
As far as men is concerned, I have an interesting question. How does fertility affect them? Like, what are like things like smoking, drinking energy drinks?
Alcohol is a huge one.
Yeah. So, thing for men is like the quality of the sperm and quantity of the sperm. So, lifestyle factors can play a big factor because they can also have inflammation. All those things affect them and their sperm quality and quantity. Also, like having too much like alcohol, caffeine, not having exercising, smoking, all those things are inflammatory. The other thing is like a poor diet and exercising can also increase insulin resistance in men, and so that can also contribute to for them not making enough testosterone at the levels that it needs to be as well. And so all those things can have an impact on the quality of the sperm as well.
That's interesting.
Yeah, and I think the whole language, as it always is, like blaming the woman on infertility things, but I think more and more awareness is that becoming that and accepting. I think some men are starting to realize like, hey, my health really does impact whether we get pregnant or not, and how the pregnancy is for the woman. So
takes two.
Exactly. It does take two.
And that's why men should go and have their levels checked and
Yes.
everything tested, right? Just like we have to do once yearly. But I also know a lot of times men are typically
Stubborn.
They
don't like going
in
to
some
the
ways,
doctor.
but I also think that's the way society kind of looks at it, right? Especially when it comes to sex, right? Like men are supposed to be the experts and those kind of things like that. And usually if there's an issue, right, maybe it's with the woman or those kind of things. Very perception based.
It's easy to blame women when we live in a man's world, right?
Absolutely.
Like, it's easy to suppress women because that's what it has been all these years, and it's changing, but in some ways it's still there. It's still there, right? Like, in an example like this, it's easier to blame the woman than it is the man.
What's the most important piece of advice you would give to all the women or to the couples out there who are struggling with any of the things or infertility?
Yeah, I'd say, I guess also kind of summarizing the things we talked about, I'd say listen to your body. You are the expert of your body. Advocate for yourself and find the right support. If you have a gut feeling that this provider is not giving you the time and attention that you deserve, find somebody else. Believe yourself and your own gut more than anything anyone else tells you, and only you can advocate for yourself. And it takes two, like having open communication with your partner.
Yes.
And I'm actually doing a workshop because I feel that men do need to get more involved in this process. And a lot of my clients, they always say like, hey, why do I have to do all these things? And it's really hard for me to make these lifestyle changes if my partner, on the other hand, he doesn't want to work out. He doesn't want to eat healthy. And here I am trying to do that. So I really want, both partners to make those lifestyle changes. And so I do want to increase that awareness, which is why I am doing a workshop about it. And I'll share the information with you guys so you can share it with your listeners. But yeah, I'd say, having those conversations early on in terms of like, what do you guys want in terms of the timeline, and what are the changes you can make now, and how you can support each other and not, blame anyone or anything. And like you said, it can become all consuming and stressful, but realize that it's also important to continue to live your life outside of this.
Don't let it consume you completely,
And that's also why like having that longer time frame is really helpful, so you're not putting all this pressure on this one thing.
What if someone wanted to get into contact with you and wanted to see you, how would they go about doing that?
That's a great question. Thank you. So my Instagram is holistic.hormones.pharmacist, or via email, hello@drelmipharmacist.com. And I'll share my information for you guys so you can include it in the notes. If somebody wants to work with me, I do offer a free 30-minute consultation, and we can just determine if it's the right fit and go from there. But I do have lots of free resources on Instagram, YouTube, podcast as well, and on my website, www.drlmipharmacist.com.
That's awesome.
Yes.
Yes.
We appreciate you having you here.
you
Lots
here.
of good information.
Yes,
Love
definitely.
your conversation. Thank you so much for having me.
Absolutely.
Thank you for coming. All right, guys, just to close it out, we'll see you guys next time at the Fill and Spill podcast. Bye.
Bye, guys.
Oh yeah, fill it up, spill it out. Oh yeah, fill it up, spill it out. Oh yeah, fill it up, spill it out. 'Cause OG and Beth know this about it. Da 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 da. Fill it. Welcome to the Fill and Spill. We laugh to laugh. We fill your plate and spill the tea and spill the tea. Pull up a chair, unwind your family here every time. This the Fill and Spill. Oh yeah, fill it up, spill it.